We have a chart here that gives you an idea of how we do nutrition assistance. Like so much of government over the last several decades, we just add more to it. So we've got program after program, a dizzying array through this algorithm. We must ask, what if this program didn't exist tomorrow? Would people still get food from the government? Probably from 69 other programs they'd get food. For example, what if we did this? What if we did food stamps, made the food stamps cover those that they're not covering, give the money to states, let the states administer it, and get it to hungry people? It'd be a heck of a lot simpler. The thing is that administration of programs, any programs, is notoriously inefficient the farther it is away from the people. The closer it is to the people through the states, the more efficient the program is. We should feed hungry people, but we shouldn't feed people who have the resources to feed themselves. We should feed hungry people that private charity is not feeding, but we shouldn't feed hungry people that private charity is feeding. We should try not to duplicate ourselves. Why? Because we spend $2 trillion we don't have.
Senator Paul has suggested that only in Washington can people believe that spending money actually saves money. And I think that is the kind of philosophy which results in us spending almost twice as much per person on health care as any other country on earth. Because we have millions of Americans who can't get to a doctor on time. Some of them die, some of them become very, very ill. They end up in the emergency room, they end up in the hospital at great cost, rather than making sure they have access to a doctor. Maybe it's the same reason why we have more people in jail than any other country on earth, including China, tied to the fact that we have the highest poverty rate among children of any other major country on earth. So the point is, and I think we have a bit of a difference here, I think Senator Franken has spoken to the fact that prevention, keeping people healthy, taking care of their needs at home does actually save money. And that if you deny those resources, if you're leaving a senior citizen home today alone, isolated, confused about medicine, not getting the nutrition they need, you know what happens to that person? That person collapses. That person ends up in an emergency home. That person ends up in a nursing home at much greater cost to the system. Senator Paul wanted to make another comment.
I appreciate the great and very, I think, collegial discussion, and we do have different opinions. Some of us believe more in the ability of government to cure problems, and some of us believe more in the ability of private charity to cure these problems. I guess what I still find curious is, though, that if we are saving money with the $2 billion we spend, perhaps we should give you $20 billion. Is there a limit? Where would we get to? How much money should we give you in order to save money? So if we spend federal money to save money, where is the limit? I think we could reach a point of absurdity. Thank you.
I think you just did.
Well, I would suggest, Senator Paul, when you have seniors in this country who are dealing with food insecurity, who are not getting the nutrition that they need, my guess is that the government is wasting substantial sums of money by not taking care of those seniors who will end up in emergency rooms, in hospitals, and in nursing homes. So you asked that question. My answer is I don't want to see one senior in this country go hungry. It's the morally right thing to do. And from a fiscally conservative point of view, saving government money, in my view, it is the right thing to do.